Now, from Monday, HIV and AIDS experts from 5 continents across the world will gather in Cape Town, South Africa, to probe the dynamics of a changing HIV and AIDS epidemic and to also address the issues that are related to prevention, treatment as well as care. From the 13th to the 15th of November, experts will participate in the 13th AIDS Impact Conference that will be hosted by Stellenbosch University and the Human Sciences Research Council. And the theme for the 2017 Cape Town Conference is titled, "What Will It Take to End the Epidemic?" Well, for details, we're very pleased to be joined from our Cape Town studios by the co-chair of the conference at Stellenbosch University, Dr. Skeen. Doctor, very good morning to you. Thank you so much for joining us and welcome to M News.
Thank you. Good morning, Alicia.
Doctor, we've got a lot of conferences on AIDS. Tell us all about the 13th AIDS Impact Conference and what sets it apart from the rest that we know of.
Sure. So I think AIDS Impact is quite a special conference because it has a very specific focus on the human face and the social side of HIV. So we have the clinical aspects as well, but we think about how the human side and the social side of HIV affects those clinical outcomes. It's a much smaller conference than the International AIDS Conference, and it's got quite a dedicated community that have attended the conference in different parts of the world and that have moved around the world with the conference. But each new conference we try and attract new delegates, and we're very excited to have it in South Africa because there's a huge amount of social science research that happens here of extremely high standard, and it's an opportunity for us to really showcase our research whilst also learning from the best of research from other countries.
Maybe expand on that, Doctor. When you speak about the human and social side of looking into the issues or the stigma around HIV, tell us more about that. What exactly will you be talking about?
So often when we think about HIV, we think of it in a kind of number of stages, the treatment and prevention cascade. So we want to try and prevent people from contracting HIV, of course. But we do want people to test for HIV and to know their status. And if they have been shown to be HIV positive, we want them to link to care. We want them to stay in care. And we also want them to become virally suppressed as a result of staying in care. So those are the kind of clinical stages that we think of. Now, if we think about the social side, we have to think about why someone wouldn't progress through those stages. So for example, let's say someone does test for HIV, they're found to be HIV positive, but then they don't actually link to care and start their antiretroviral regimen as they should do. Often the reasons why someone doesn't progress and actually start treatment are social reasons. So it could be, for example, stigma, that they don't want to tell anybody that they're HIV positive, and they don't want to have to explain to their families or friends why they have to go back to the clinic so often. It could be something like economic reasons, not being able to afford to go back to the clinic. So it's all those kinds of issues that we try to look into at this conference so that we can really maximize the clinical side of things.
Doctor, as you mentioned there that, there's still a huge stigma that is attached to whether you've tested positive or not, or you are living with HIV. Let's talk about research that you will be unpacking during the course of this conference. What are some of the biggest strides that have been taken, particularly in South Africa, which has one of the highest infection rates since 1991?
Sure. So some of the issues, in terms of stigma, one of the plenary speakers, Dr. Tamsin Rashad, has done a lot of work on disclosure within families. So she'll be speaking a little bit about that, about how parents, for example, can tell their children about their HIV status. But there's other issues as well that we're going to be looking at. Gender is a huge issue at our conference, and in fact, it's quite a cross-cutting issue across a number of different sessions. So there'll be some sessions that focus on women's health issues specifically, so things like pregnancy and childbirth, but with an HIV perspective and how they link to HIV. We also will be looking at women's substance use and how that links to HIV infection. And then I guess most critically, and it's something really topical at the moment, is that we'll be focusing very strongly on gender-based violence. We know that it's one of the key drivers of HIV infection, and it's something that we really need to reduce in South Africa and other parts of the world. So a lot of the sessions focus on how we can integrate violence prevention into HIV prevention programs and also into HIV treatment programs as well, instead of just dealing with the HIV prevention or treatment by itself, but rather integrate it into the wider context in which it actually happens.
Yeah, and on
some of the other issues. Sorry, yeah.
Yes, continue, Doctor.
I was going to say another issue which is going to be quite highlighted at the conference is that of children and adolescents. So what's happened recently, particularly in the last 10 years, is that the number of child infections have dropped quite substantially. But still, children are quite neglected, actually. Children who are HIV positive, there's much less research on that group than there is on adults, for example, in terms of clinical outcomes. So we have children who are infected themselves that might not be getting the kind of research attention that they should be. But there's also a huge number of children and adolescents who might not be HIV positive themselves, but their parents are HIV positive or family members are HIV positive. So that's another group that will be very much focused on at the conference. And we're also quite happy that we've got children attending, and they'll be participating in 2 different media projects. There'll be a children's radio station that's broadcasting from the conference with children from all over Southern Africa. And there'll also be some art displays from an NGO near Knysna called Mad About Art, which is the art of children affected by HIV that will be on display as well.
That's wonderful news, Doctor. I was getting excited with your previous point because Professor, your co-chairperson there, Professor Heidi van Rooyen, says to actually stem this epidemic in South Africa or in Africa, then addressing poverty. And as you rightly mentioned, gender inequality and gender-based violence, which fuel often the spread of HIV among vulnerable population, requires urgent attention. How does the conference seek to address this or find solutions to this statement, Doctor?
Well, I mean, in terms of the solutions, I guess we'll have to wait and see what solutions come up. But I think the main thing that's really happened since 1991, when the conference first started, is that we've started to understand that there are these massive social drivers like poverty and inequality and gender inequality, as you mentioned, that drive everything. So people are starting to test out different types of interventions to try and address these integrated with HIV. So, for example, one of the speakers, Fred Suamala, who's originally from Uganda but works at Columbia, he's going to be presenting on some work that he's done in Uganda, trying to use economic strengthening with adolescents who are orphaned by HIV. So often these children, for example, wouldn't stay in school, or they would drop out of school early because they don't have the kind of family support that other children might have. But he's done a range of research projects where they've actually given these children financial management lessons, they've given them small cash transfers and support to stay in school. And it's had quite amazing impact on the outcomes for these children. So people are starting to think bigger than just providing the clinical treatment, and what other kinds of social programs can actually work to try and address some of these issues like poverty and violence. Some of the work from Stellenbosch University, from the unit where I work, will also be on display on Tuesday. We have a special session where we are trying to show that we really integrate HIV into other programs, other general health and well-being programs. So we have a session where we're going to focus on 2 different programs that we are involved with. One is in Mokhotlong in Lesotho, and actually it's actually a parenting program. So it's for people with children below the age of 5. We focus on nutrition because it's a big issue in Lesotho, particularly that part of the country. We focus on early childhood development, kind of play, and using books for cognitive development. And then we encourage parents to take their children for testing. So it's very much integrated into a general health and well-being program, and it's been very successful. We have another program also in Khayelitsha that we'll also be showcasing, which uses a soccer league to engage with unemployed men, to teach them hard and soft skills, which will hopefully help them to get jobs. So the soft skills are more the team skills that they learn within the league, within the soccer league, like arriving on time and being part of the team. And then hard skills, they're involved in vocational training programs so that they actually get a skill that will make them more employable. And that so HIV prevention and substance use prevention are integrated into that program as well. And we're actually going to do a demonstration of that at the conference. And again, it's been very successful, very well taken up. So we just I think the conference will really be a showcase for this type of integrated intervention, integrated approaches, which do address some of these social issues.
All right. And Doctor, if you're calling it a showcase for these important strides that have been taken, are the important role players like your health department going to be there to try and listen to some of the resolutions or solutions that are undertaken at this conference, and also to effect some of those resolutions that you come up with at this place, so that it's not just another talk shop?
Sure. So we've worked very closely with the South African National AIDS Council in developing the program for the conference, and there'll be a special session with them, which has a number of different representatives from the Department of Health. We also have other representation from UNAIDS and other and NGOs and international organizations from across the globe. So hopefully it will be an opportunity for everyone to come together to share what they've done, but also to listen and learn from each other.
Absolutely. And the last one, Doctor, before I let you go, those details once again, the dates and where it's going to take place and who can attend as well.
So it'll take place from Monday to Wednesday next week. We have a website, which is www.aidsimpact.com. And it's happening in Cape Town at the Century City Convention Centre. But for those people who would prefer to follow on social media, we have a hashtag, it's AIDS Impact 2017, and we'll be tweeting and posting from the conference throughout the day.
Absolutely. Thank you so much, Doctor. And of course, we'll definitely try and see if we can accommodate you during the course of this week as, of course, you take upon that conference. That is co-chair of the 13th AIDS Impact Conference, Dr. Sarah Skeen, talking to us about the conference. Go out and check out the website. It is taking place next week. And of course, as you know, December is when we observe World AIDS Day.